And we continue now with our great American panel. Well, you got to give it to the Democrats. They're leading Congress. They really have done a great job at 21%. And then they're gonna use the nuclear option and ram this down America's throat. Politically, will conservative Democrats face a backlash?
I think they're obviously afraid that they will. That's why you have so much hemming and hawing about this bill. But look, we're either going to do something serious about health care in America and our deficiencies, or we're not. And at this point, I think we're not. So I'd rather do nothing at all. Do no harm rather than pass something that.
How about tax cuts for people that can't afford it so they can get their own insurance? Okay, how about portability? How about tort reform? How about medical savings accounts? How about we even discuss these things, but the Republicans have been shut out? Their ideas are...
I think all of those things are well worth discussing, and we need them, but we also need to do something about containing cost, and a public option is essential for that. And if this president, who campaigned on that and said it was essential, flip-flops again on that issue, I think the left wing of his party and even the mainstream of his party going on here.
You want the government option?
I agree with that. I mean, I don't think the public option is a far left thing. You know, people try to portray it that way. I think it's a mainstream. Most Democrats support the public option. I agree that it's the way to contain costs. It's, in fact, the only way to contain costs.
The American people don't want it. The American people don't want it, and Congress has a 21%.
There was a New York Times poll that showed that the majority of Americans did want it. But at the end of the day,
is that what the poll that polled 2-to-1 Democrats over Republicans? That poll?
Always attacking the poll.
I'm sorry.
All of the things that you mentioned, Sean, I agree with Judith. They're fine. There's nothing wrong with them. But they're not, even if you added them all together, they would barely even touch the problem.
Here's the problem. Everywhere socialized medicine has been tried, it's failed. It ends up in rationing. It ends up bankrupting the country. You know, look at Great Britain recently. Women with breast cancer. They were denied drugs by who? The government rationing body.
Well, the Canadians, when they have a real medical problem, they come here to America to get their health care. But this was what Obama did. He made a strategic mistake. He said, let's take the best Republican ideas and the best Democratic ideas and put them together and have a bill, and he didn't do it. If he had pushed a public option but also said, let's also expand the association of health plans, let's also expand HSAs, and then he might have a chance.
You're saying the Republicans would have supported a public option?
I'm saying that he would have split the Republican Party. But now what he's got is the Democrats are split.
Rasmussen's numbers were 43% in favor, 56% against.
In favor of
health care,
okay.
and 56% against. Look, we've seen widespread opposition. There's a reason why Harry Reid is saying he's going to use the nuclear option. So we're at this point now. We've scored it. The CBO says two things today. $1.4 trillion in debt Obama has accumulated. And number two, they want to spend another trillion, preliminary numbers, 25 million still uninsured, if they go with the Baucus plan, which they're not going to go with. How much more money in debt can we put on our children and grandchildren?
The issue is, what are you adding debt for? If you're adding debt that is ultimately going to make a system more efficient 10 years from now, which is what the Democrats are saying about their plan, then it may be worth it.
Medicare ended up being 9 times what it was originally projected to be.
Because of the cost, Sean. You're making my point.
No, you're making my point.
A single thing that the government has made more efficient.
Excuse me, wait a minute.
Wait, that's a great question. That's a great question.
A single government program that the government has made more efficient.
How about veterans care? How about veterans care?
It's atrocious.
No. Compared to what? Compared to Medicare?
That's not the comparison. The comparison is compared to what? The insurance companies.
Yeah.
The insurance companies are very inefficient, and they deny people coverage.
Ways to deal with those deficiencies.
But every criticism you have for the public option, you can make for an insurance company.
But go back to this. Post Office, FDIC, Fannie and Freddie, you know, Medicare, Medicaid, Social Security, all bankrupt.
I would actually agree, but I would agree. I would never support the socialized medicine the way the UK has, where the doctors are working for the government, the hospitals are run by the government. That's not what the Democrats are talking about. They're talking about a public option for a certain number of people.
But the Heritage Foundation did a study. And by the way, even the original CBO scoring of the House bill showed that tens of millions of Americans will be forced into the government plan. You know, in the case of the Heritage Foundation, it was, what, 83, 89 million, because there won't be an option. The private insurance companies will not be able to compete.
Well, that would be wonderful if they're charging so much.
limits on what they can charge, and they're going to put unfunded mandates on them.
The bill that everyone says is such a moderate option takes millions of children on S-chip, who are getting private insurance, and puts them into Medicaid.
Look, the insurance
so
companies
we
are
got to
expand government with Medicare and Medicaid.
Fire Jennings, you want to answer? Fire Jennings?
Yeah,
Fire Jennings. All right, we're going to stay on the story. I promise. The rest of the media is absent. MIA. That's all the time we have left this evening. Let not your heart